Antibiotics are often called miracle medicines, but few people truly understand how fragile this miracle really is. Imagine waking up in a world where a simple fever no longer has a cure, where a small cut on your finger could turn into a life-threatening infection, and where doctors stand helpless because the medicines they once trusted no longer work. This is not a story from a dystopian future. This is a reality we are slowly moving toward, and it is called antibiotic resistance. Before antibiotics were discovered, infections were among the biggest killers of human beings. Pneumonia, tuberculosis, wound infections, and even childbirth complications took millions of lives. A sore throat or an infected tooth could mean death. Hospitals were places of fear, not healing. Then came antibiotics, starting with penicillin in the early 20th century. And everything changed. Suddenly, infections became treatable, surgeries became safer, life expectancy increased dramatically. Antibiotics became the foundation of modern medicine, silently protecting us every day. But here is the hidden danger. Antibiotics do not work forever if they are misused. These medicines are designed to kill bacteria or stop them from multiplying. They do not work against viruses like the common cold, flu, or most fevers, yet across the world, antibiotics are taken unnecessarily, without prescriptions, in incorrect doses, or for incomplete durations. Each time this happens, bacteria learn how to survive. They adapt, mutate, and grow stronger. Over time, the medicines that once killed them become useless. This process is known as antibiotic resistance. When bacteria become resistant, they turn into what scientists often call superbugs. These superbugs do not respond to common antibiotics and sometimes resist multiple drugs at once. Infections caused by them are extremely difficult to treat, require longer hospital stays, and cost much more money. According to global health experts, antibiotic resistance is already one of the biggest threats to human health, food security, and development. Now imagine what would happen if antibiotics completely stopped working. The first and most immediate impact would be on common infections. Diseases that are easily cured today, such as urinary tract infections, pneumonia, skin infections, and even minor wounds, would once again become deadly. Children, elderly people, and those with weak immune systems would be at extreme risk. Something as simple as a scratched knee or a tooth infection could spiral into a life-threatening condition. The second major impact would be on modern medical procedures. Surgeries rely heavily on antibiotics to prevent infections. Without effective antibiotics, procedures like cesarean deliveries, appendectomies, organ transplants, and heart surgeries would become incredibly dangerous. Cancer treatments such as chemotherapy, which weaken the immune system, would also become much riskier. Many treatments we consider routine today would simply not be possible. Hospitals themselves would become dangerous places. Instead of being centers of healing, they could turn into hubs for resistant infections. Drug-resistant bacteria spread easily in crowd and hospital environments, especially in intensive care units. Doctors and nurses would be forced to watch patients suffer without having effective tools to save them. This emotional and ethical burden on healthcare workers would be enormous. The economic impact would also be devastating. Patients would remain sick for longer periods, unable to work or support their families. Medical costs would rise sharply due to prolonged hospital stays and the need for expensive alternative treatments. Developing countries would suffer the most, but no nation would be safe. Antibiotic resistance does not respect borders. In fact, this crisis already begun. Around the world, there are cases where patients die not because their disease is incurable, but because no antibiotic works anymore. Drug-resistant tuberculosis, hospital-acquired infections, and resistant pneumonia are becoming more common. Health organizations like the World Health Organization have repeatedly warned that we are heading toward eye care if urgent action is not taken. So what can be done? The good news is that this disaster is not inevitable. Each of us has a role to play. Antibiotics should only be taken when prescribed by a qualified doctor. The full course must always be completed, even if symptoms improve. Antibiotics should never be shared or saved for later use. Good hygiene, clean water, proper sanitation, and vaccination can significantly reduce the need for antibiotics by preventing infections in the first place. Governments and healthcare systems must also act responsibly. Antibiotic use in livestock and agriculture needs strict control. Hospitals must strengthen infection prevention measures. Scientists need support to research new medicines, diagnostics, and alternative treatments. Most importantly, public awareness must increase, because misuse often comes from lack of understanding. Antibiotics are not just another medicine. They are a precious, limited resource. If we waste them, we may lose one of the greatest achievements of modern science. A world without effective antibiotics would be a world where medicine moves backward, where fear replaces confidence, and where survival becomes uncertain. The future of antibiotics depends on the choices we make today. Use them wisely, respect their power, and help ensure that these life-saving medicines remain effective for generations to come.